Assalamu alaikum and hi. In today's video, we are going to discuss about drug agonist and drug antagonist, a very important concept in pharmacology. So let's start the video. Definitions. A drug agonist. A drug agonist is a molecule that binds to a receptor and activates it, resulting in a biological response similar to that produced by the endogenous ligand. Agonists mimic the action of endogenous neurotransmitter, hormones और other signaling molecules. ड्रग एगोनिस्ट क्या है? जब हमारे पास एक ड्रग रिसेप्टर को बाइंड कर जाए और उस रिसेप्टर का बायोलॉजिकल रिस्पांस माइमिक करे। ये बायोलॉजिकल रिस्पांस एक्टिव इनहिबिटरी भी हो सकता है और इनिशिएटिव भी हो सकता है। ये ब्लॉकिंग इफेक्ट भी हो सकता है हमारे पास और ये हमारे पास एक स्टार्टिंग इफेक्ट भी हो सकते हैं। तो ये क्या है? ये बायोलॉजिकल रिस्पांस है। एगोनिस्ट इस बायोलॉजिकल रिस्पांस को माइमिक करेगा, ना कि ऑलवेज एक्टिवेशन करेगा। एक्टिवेशन का मतलब ये है जो कि रिसेप्टर का काम है उसी को इनिशिएट करे, एक्टिवेट करे। और मैंने कहा कि रिसेप्टर का बायोलॉजिकल रिस्पांस मे बी बोथ इनहिबिटरी एंड इनिशिएटिव। ड्रग antagonist क्या है? A drug antagonist is a molecule that binds to a receptor but does not activate it. Instead, antagonists block the receptor from being activated by endogenous ligand or agonist, thereby preventing or reducing biological response. Antagonist will not allow this agonist to show his activity, so antagonist will stop the activity or biological response of a receptor by inhibiting the binding of agonist. Effect on receptor. Agonists activate receptor initiating a cellular response. They can fully activate the receptor or produce a submaximal response depending on their efficacy. They can fully activate receptor. Drug antagonist. Antagonists bind to a receptor but does not activate them. Instead, they occupy the receptor site, preventing agonist or endogenous ligand from binding and eliciting a response. This effectively inhibit or block receptor activity. देखो एंटागोनिस्ट का इंट्रिंसिकली कोई प्रॉपर्टी नहीं है कि रिसेप्टर को ब्लॉक करे। ये जस्ट एगोनिस्ट को अलाउ नहीं करता बाइंडिंग के लिए। Biological response. Agonists produce a biological response that mimics the effect of the endogenous ligand. They can initiate a wide range of physiological responses depending on the specific receptor and its signaling pathways. Drug antagonist. Antagonists do not produce a biological response themselves. Instead, they inhibit or block the action of agonists, resulting in suppression or reduction of the biological response that would normally occur in the absence of the antagonist. Clinical applications. Drug agonists are used therapeutically to activate specific receptor and produce desired physiological effect. They are commonly used as medication to treat various conditions by enhancing or mimicking the action of endogenous substances. Drug antagonists. Antagonists are used therapeutically to block the effect of endogenous ligands or agonists. They can be used to counteract the effect of excess neurotransmitter, hormone, or other signaling molecule, and are often employed in the treatment of conditions such as hypertension, allergic reaction, or opioid overdose. Examples: morphine is an agonist that binds opioid receptor in the central nervous system, producing analgesia and euphoria. Opioid क्या करता है? Opioid receptor will inhibit the transmission of pain. When morphine binds opioid, morphine will activate opioid. Opioid will decrease the pain transmission of pain. So this is agonism phenomena. Drug antagonist. Naloxone is antagonist that bind to opioid receptor but does not activate them. It is used as an antidote to reverse the effect of opioid overdose by completely displacing opioid agonist from their receptor. देखो यहाँ पर क्या हो रहा है? डिस्प्लेसिंग हो रही है एक एंटागोनिस्ट एगोनिस्ट की। यहाँ पर एक्टिविटीज माइमिक हो रही है, मिमिक हो रही है। Summary. In summary, drug agonist and drug antagonist have opposing effect on receptor activity. Agonist activate receptor and produce biological response. Biological response inhibitory भी हो सकता है और initiative भी हो सकता है. While antagonist block receptor activation and inhibit the action of agonists or endogenous ligand. Endogenous ligand activation भी कर सकता है और inhibition भी करता है, लेकिन receptor का opposite काम किसका है? Antagonist का है. Understanding the difference between agonist and antagonist is essential for pharmacological research, drug development, and clinical therapeutics. So that's all. Thank you so much for watching. If you learned something valuable from this video, please give a favor, like this video, and subscribe this channel. Thank you so much for watching.